needs to be done to ensure that communities lead? And this is where I really just want to address the governments. The county government needs to strengthen the community systems, which I know you are working on. I think there is need for investment in, and you have acknowledged it in your speech, Honorable Minister, when you talked about increasing the centers. So there needs to be, I think, more investment. I am aware, because I've read the county budgets, that actually the health department does consume quite a large part of the budget, but it needs to be more. And the national government also needs to do its part in terms of investing in universal health coverage. I think what the minister said about insurance, I will just emphasize to say that as national government rolls out the universal health coverage, then attention also needs to be had to those members of our community who may not be able even to afford the 300 shillings or whatever it is that is being proposed. I saw that if you live with somebody, even if you don't have a job, you are supposed to pay them 300 shillings. Where are you going to get it from? So these are issues that I think the national government needs to address, because investing in community-led activities as a response to HIV and AIDS needs to be accompanied by an investment in resources and in manpower. Now, I was very impressed to see expert mothers and expert mentors. I think that is something that is such an innovation that can be replicated. The organization, I met some expert mothers and some expert mentors over there in the tents. I think that is a program that we can replicate and multiply so that we have more expert mothers and more expert mentors, because they will help us in the 5 actions that communities will lead in. And these 5 actions are advocacy and information sharing, indirect participation in service delivery, so that even though we have 2,000 Nyamrerwa in Siaya County, we can have the expert mentors and the expert mothers also helping us. And then the last issue is around communities being involved in participatory research, so that when you come to Siaya to find out how we are dealing with this new rate of infections, how we are responding to the triple threat, you are involving community members in the research. That is all I wanted to say, and to say that we are going to work to accelerate the end of AIDS. I think I don't know what the percentage is, it's 95, 95, 95, something like that, and we are at 80. Oh, we're 92, so we only have 3 points to go. So I think we can do that. We are going to accelerate actions towards engaging our community members more meaningfully. We are also going to accelerate action towards closing the inequality gap, because you can't do HIV responses without now looking at climate change, and I think our Waziri for Governance and the DCC mentioned it, because we will get more vulnerable people, more vulnerable children if we're not dealing with climate disasters and closing that inequality gap. We have to end stigma. Stigma is coming back around HIV, and it had ended. So we have to do our work against stigma, and we have to work towards ending gender discrimination so that we stop doing violence against girls and against women. And also, as the Kababa Act people showed here, there was a man who was being beaten by his wife. Yes, that happens. but on the large part it is women and girls who are still the targets of gender-based violence. And lastly, let me just appeal to our partners. Let us not work in silos. If we can integrate our actions, I think we'll get better success. I know in Siaya, in the nurturing care work, all partners meet and agree on how they are going to work. I'm sure in health probably it is the same, but just to re-emphasize that we need to do that so that we can have better outcomes. I thank you very much, and I bring you greetings from your governor. We have now seen a rise in sexual and gender-based violence, which is part of the triple threat that Randy have talked about here. So with SGBV, you also get HIV infections rising, and then you get what the government calls adolescent pregnancies or teen pregnancies. Teen pregnancies are violence against girls and children. There is nothing like a teen getting pregnant. A teen is made pregnant, often by, I'm called mubabas. Often it's always by force, and sometimes, I think it's okay. Yeah. Often it is by force, under coercion, and under circumstances where force is used. In our laws, we call it defilement. And some of it is, rises to torture because the children get very badly injured. They then suffer other medical conditions such as fistula because their bodies are not ready to have babies. And in the process, a lot of them are getting HIV infections. And so we saw in this year's KNDS report that our prevalence rate has risen to 14.1%, which is 4 times the national average. This is not acceptable, and this is something all of us are going to campaign against. We are going to let the communities lead as they have been doing. Actually, Waziri, when I saw the theme for this year's World AIDS Day, I think they're just reminding us, because in Siaya and across Kenya, I'm aware that communities have been leading the fight against new HIV infections. A lot of research has been done by many NGOs working on this issue, and they have found that community engagement leads to greater access to treatment, actually up to 64%, and to prevention. Community engagement also promotes human rights and the demand by community members of quality of service. So when communities are being consulted, then they say that service we got is not what we expect, and so on. And our partners here will tell you, the National AIDS Control Council will tell you that they have been working with communities ever since we learned about HIV and AIDS. Communities also, working with communities also ensures that we achieve scale. Because how else are you going to achieve scale and get as many people as possible having access to treatment and having the information they need so that they can prevent the infections. But now,
kwa timba kali za Afrika, DURB Radio ndio mpango mzima.